Our story begins in the late 18th century with Luigi Galvani, an Italian physician and physicist. Galvani discovered that when a spark of electricity hit a frog's leg, it twitched. This was the first documented evidence of bioelectricity. Building on his uncle's discoveries, Giovanni Aldini took bioelectricity to another level. In the 1800s, Aldini experimented with applying electrical currents to the human body. One of his most famous demonstrations involved using electricity to make a human cadaver's muscles contract in front of an audience. It was a shocking spectacle that blended science and theater, but it was also an important step forward in proving the connection between electricity and muscular movement. Fast forward to the 19th century, when Hermann von Helmholtz made a pivotal discovery that would shape modern neuroscience. In the 1850s, Helmholtz measured the speed at which nerve impulses travel through the human body, revealing that these impulses were much slower than electrical currents in wires. His work showed that nerve conduction was a form of electricity, but at a slower, more complex pace, a crucial insight that helped us understand the nature of neural communication. By the 1920s, the study of the brain's electrical activity took a giant leap forward. Hans Berger, a German psychiatrist, invented the electroencephalogram, EEG, a device that could measure electrical activity in the brain using electrodes placed on the scalp. In 1924, Berger recorded the first human brainwaves, showing that the brain wasn't just a static organ but a dynamic, electrically active system. This laid the foundation for later advancements in brainwave research and clinical applications. Moving into the 1930s and 1940s, Wilder Penfield, a neurosurgeon, made a significant contribution by developing the Penfield map of the brain. During surgeries, he would electrically stimulate different areas of the brain and observe the effects on his patients, mapping out which regions were responsible for movement, sensation, and even emotions. Penfield's work revolutionized our understanding of brain localization, proving that specific areas of the brain are dedicated to specific functions. In the 1950s, deep brain stimulation, DBS, emerged as a groundbreaking treatment for neurological disorders. Initially developed as an experimental therapy for Parkinson's disease, DBS involves implanting electrodes into the brain to send electrical signals to specific regions, alleviating symptoms like tremors and rigidity. The success of DBS has paved the way for similar treatments in conditions like epilepsy, depression, and obsessive-compulsive disorder. By the 1970s, the concept of brain-computer interfaces, BCIs, began to take shape. Scientists like José Delgado demonstrated that electrical brain stimulation could influence behavior, and researchers started experimenting with systems that allowed animals and humans to control machines directly with their brain signals. These early breakthroughs laid the groundwork for the BCIs we see today, which help people control prosthetic limbs, communicate, and even interact with computers through thought alone. Fast forward to the present, and we've entered a new age of brain mapping and neural interaction. fMRI and PET scans allow us to visualize brain activity in real time, opening new doors for understanding how the brain works. Meanwhile, cutting-edge BCIs and neuroprosthetics are helping people with disabilities regain control over their bodies, and even neurostimulation techniques are providing hope for patients with mental health conditions like depression and PTSD.